Good afternoon. Today is June 23rd, 2023. As we are getting closer to the election year 2024, all the new campaigns are starting. We'll try to highlight top issues for Delaware. I personally am involved with some of our candidates, working with them directly, and that puts more responsibility on us for us to be able to cover this in the right way. So that's what we are going to try to do. As you may remember from last week, our top concerns are education, economy, corporate social justice, crime, energy and climate crisis, healthcare, housing, immigration, and infrastructure. So since last week, prior to last week, actually, Sean and I, we've been working on different issues, looking into more information and see if we can actually channel the issues in the right way, and then maybe find the people who can actually answer us in the right way. So there was a study in 2014, and then since then, our goal was for last week to see if we can get an updated study for 2022 or even like maybe 2023, and we have some information now. So we are going to actually share those with you. And Sean, if you can give the background on this UD study, and then we'll go to the other one after that.
So as Kemal mentioned, we did originally find the study from the University of Delaware Arts and Sciences program. And that study kind of incorporated, it took on like a survey, census type approach, kind of gather information on the state, residents, how they were feeling about the current living conditions, living situations in the state back in 2014. And that did cover, like I said, the key issues facing Delaware is the name of their study. And some of the topics that were actually heavily important, I should say, most important to these residents back 10 years ago was the employment and wages, public safety, criminal justice, education, schooling, and then government affairs were the top leading ones 10 years ago.
So that's in that study, 2014, the employment and wages, that was the 30% number one concern, right?
Correct. Yeah. Overwhelmingly, three times the second up, public safety, criminal justice was actually it's at 18%. So close behind, but less than 2/3 of what that employment and wages concern was back then. So I know it kind of does make sense if you think about the 2008 financial crisis that we had. So people were definitely still feeling the hardships of that, even just a handful of years later. So it's not surprising that the employment and wages are a top concern, but also having that criminal justice, public safety following up in second, and then the education system is third. If you recall on some of our previous sessions, even with Senator Townsend a couple of weeks ago, we know that education reform is one of his big concerns too. He did speak on that a little bit. So it seems to be something that's still in the mix, even after 10 years or so. It's still up there on people's concerns. And actually what we're going to do here in a little bit is just kind of go into some detail on what's changed over this last decade, and kind of what this new study that's conducted, what that found in terms of what people are valuing the most, and what they're paying closer attention to now as opposed to a decade ago.
Well, one maybe important information for everyone to know is in the 50 states plus DC, right?
Yeah.
So we are ranked 44 overall.
You want to be single digit ranking,
right? So now, and it's also like you would think that for being a small state, there are some advantages and disadvantages, but I think there are certain things that if you make it like it used to be in the old MBA days, where you have a niche, you create that niche, and that can actually bring more more employment, more development, and I think we are maybe struggling there a little bit. So like in the last maybe 10 years, I would say easily, there is definitely a decline that we would like to actually see a better increase. The University of Delaware is a great college. I don't know if it's getting enough recognition for what it is in terms of its ranking and others. Even our hospital systems are very strong. Our healthcare is strong, but I don't know if we are getting enough recognition for those either. So now part of the issue is, as we always kind of address issues in a way that what we see is what they want us to see, right? So the media is the biggest driver for how we form our opinions and our views, and that's why it's important to kind of address these issues from the root of the problem. So understanding why it's happening, or is there some dependence on these, like just because that's the bank like MBA pulled out doesn't mean that everything has to go down, right? So can we actually have a better proportionate distribution of these contributors to the system?
Sure.
So
yeah, I think just go back through history where people were getting their news, and back in the day it was newspaper, then radio, now television, and now you see even social media with our social media apps and those different platforms on how quickly we're getting news now. And just think about historically, people are using what's presented to them to then make their decisions, and they're you're almost in a way you have to be open up to be influenced by what you're reading, what you're being presented, whether it's what you're hearing on the radio, seeing now on your phone, scrolling on Twitter, on Instagram. So people, you have to, in a sense, like I'm saying, let it influence you. We also do mention that you should do your due diligence and background research on some of these stats, findings that are being presented.
absolutely.
A lot of them, it's once you read down further in the article, you'll see the headline may say one thing, but when you get to the fifth paragraph, there'll be a totally different idea on how they're trying to tweak it and twist it to have to make itself present one way in this sort of spotlight as opposed to a different view. So as you're mentioning, though, it should try to be a non-biased, just straight factual, here's how it is, interpret as you please. But we know with the media, it's not always like that.
Political views affect our understanding and the way that we process
it. Could be the same sentence and two different people could interpret it two different ways, of course.
So if we were to go into this Franklin and Marshall study, that's the most updated study in Delaware with 500 people. What we see, we are going to share some of these with you guys now, but what we see is based on your politics, how you like to, what you believe in affects what you see and your opinion. So based on this study, whether or not Delaware is on the right direction, so that's about 49% of the people overall. Although I don't know if 500 is a good number, and I don't know how they pick these people.
Yeah, I would agree too.
No, I didn't get this call, for example, like they didn't survey me.
Yeah, I know some of the classes I took back in my time at University of Delaware did cover on what basis a solid research study needs to meet population size on those test subjects, based on where you're pulling from, or is it diverse enough that you're seeing the whole population? So if you're going to say a claim on the state of Delaware, like you're saying, is it pulling up people from diverse backgrounds, different geographical locations within the state, or is it focused on one particular area where everyone may be like-minded? So as you're saying, 500 for this study, I'm not sure if that is a big enough number. You don't want to have something 20,000 people, so it's obviously
it's a good number, right? So like most studies probably don't get a lot of people, but when you Delaware in the last several years, Delaware is now moving to blue states. So you would expect that the right direction overall, the idea on the right direction, the opinion on the right direction would be higher because.
Correct. You wouldn't expect a 50-50. Like if it was a swing state traditionally, you'd be like, oh, this is literally exactly what we expect. It could be half the people are this way, half the people are that way. But as you're saying, traditionally blue, you'd expect a much higher backing the fact that it's going in the right direction.
So now this number again. So just for those who may not know how Delaware is situated, so Newcastle County in the north, Kent County in the middle, and Sussex County is the south. So, and it's Democrats kind of in the middle and Republican from north south. So it's kind of like a small U.S. in the state level. So now, when this question is just for Newcastle County, it's at 56% of the people they believe that we are on the right direction, versus in Sussex County it's about 36%.
Right.
So then, when you look at the generic level for the population, people under 35 and under, they are at 74% of the people they believe that we are on the right direction, versus people over people 55 and over. This number goes down to 39%.
Yeah.
Now, what do we make out of that?
Yeah. So if you're just looking at that statistically, you want to group it to make an overarching claim. It's younger people in the north are saying that the state is in the right direction, whereas older people, southern, are saying that it's not.
So you don't want to say older or younger, right? So
Well,
the 35 and 55. So okay, but so why do you think that those who are under 35, let's call them younger people, they are happier with the direction that we are at?
Well, I'm sure I'm going to use the word older here. The older population. When
you're one of those people, right? So how would you answer if you were on the right or wrong direction?
Well, so technically I am Delaware resident now, although I didn't.
Well, you've been here for several years now.
Yeah, going to school here. But yeah, I do still need to change my driver's license. But in the short amount of time, I mean, like you're saying, having a small state, there are advantages and disadvantages, and the fact that you're saying you need to find your niche, kind of what your state is good at and what it's not good at. But for me, I know we touched on this even in the last session or two about, when I think it was comparing to crime, like it's pretty similar to the suburbs of where I'm from in New York, where I grew up, from what I'm seeing here. Obviously, me, like transportation wise, there is, we have quick access to, if you want to fly out of Philly or even Wilmington, you can fly out of. Getting around here just locally to commute to work, minimal drive for me on the highway, but I'm not like saying a city urban where it's walking distance, or I'm relying on a bus or like a taxi or Uber or something like that. So living style down here for me is similar to what it was in New York suburbs. But in the right direction though, I feel like where I was kind of going at the beginning, where the older population, they've maybe seen or experienced like a full cycle. I don't know if there's a better way to phrase it, but they've seen something play out like a few.
They have experience.
Yeah. Whereas like the younger people, like, we think about it, you can vote once you're 18. So until then, you're probably not paying attention to politics.
Even then, you're
like, yeah, even like you're saying. So it's once you get into like university, where all of a sudden you're like, oh, that seems good to me. And I know a lot of the big pull for the younger, the millennial, younger population is the economics behind it. They traditionally seem to support democratic policies when it comes to economics and the outlook on that, as opposed to once you're older, the older population tends to have a more conservative approach towards economic policy.
I think the environment that we live in has a lot to do with our opinions, how we are forming our opinions as well, right? So one of the part of the study says in the overall in Delaware state level, number one issue now is crime, drugs, and violence. So that's 18%. But when it goes to just Sussex County, that number is at 8%.
Yeah.
In fact, the number one issue for Sussex is
urban sprawl, a concern about population.
Urbanization. Why? It would be because it's either it's the beach or the rural area of the
they said the lower Delaware. It's not as you're saying urbanization up here, where in Wilmington, city life, there's much more compact population in a smaller area, whereas once you get down south, you're saying rural, spread out, houses may be on more acreage. it's a little bit further drive, maybe you're on the grocery store versus you can walk when you're in the city. But yeah, that is the concern that it said in this survey. For those in Sussex County, their top concern is urbanization and that urban sprawl, where they kind of don't want it to be cookie cutter stacked on top of one another, condensed. Like they want that relaxed, open.
But there's give and take there, right? So like when you look at economy of scale and how expensive the infrastructure is.
Mm-hmm.
So then when you don't want development, someone is going to pay for that. So it becomes a lot less affordable in those cases. Now when everyone wants to be in a bigger lot or bigger area, like they don't want it's just like there's some balance there that you have to have better planning in order to actually avoid some of these, and you cannot just have one way or the other way. So you have to have a balance, right?
Yeah.
But how interesting it is to me that, well, not interesting maybe, but it's kind of like what I would expect to see is something similar to this. So based on where you live, this safety becomes more problematic because you haven't experienced any of those.
Exactly. Yeah, it's kind of what's in their backyard. So, like you're saying, if you're down south, like the police crime rate, that may not be as high of a concern because you're not experiencing that as much down there. But say if you live in the more urban area up here, the crime rate, as we mentioned on the last session, how Wilmington crime rate is, super high on the city's ranking across the entire nation, that per capita ranking. So if somebody who's living there would obviously want that police presence, the safety, that's going to be higher on their list of concerns versus.
Like where I live now, it's closer to the city from my other house. Mm-hmm. And in the neighborhood, we pay extra for extra police officer 24/7. And when you see the guy, like so like when you see the police officer in the car, you feel safer. Mm-hmm. But we pay extra for that. Now, because as you are closer to the city, then your concerns are changing. When I was like 4 miles from where I am now, I didn't have that problem.
Right.
So I think that's kind of just makes sense, some of these. But in this survey, they asked so many different questions, right? So the questions were about, you said about 50, but the 20 are mainly enrolled in the education, school, healthcare, insurance, economy, immigration, illegal immigrants, and refugees. But there are total 50 questions.
That's what I saw, that number. So they put 50 questions to more than 500 of the state's adults. So we don't have those exact questions, but I guess of those 50, 20 were focused on the areas that you just mentioned and listed right there. But again, I think the theme that we're seeing here is depends where geographically you're located, what you're going to value more. And not that it's selfish, but I think that people are going to want what's best for them. So if they're in an area where they need XYZ more so than this, then that's what they're going to value more. So who's going to be supporting the policy that I want for XYZ? Whereas if you live in a different area, may not give you careless things. It doesn't impact me. I've never dealt with this. Why would I care if there's funding for this or people are going to be pushing this? So
that is correct. So what we wanted to do is to get into the actual results of this study. So we are going to actually get that also in the next couple of weeks.
Yeah.
The mayor of Wilmington is one of the people that we invited, and the person who's actually running, challenging the existing mayor, is going to be hopefully part of the show. So with this elections season, we are going to be bringing a lot of candidates, so then we can actually ask them certain questions directly, and then we can also take questions from our audience and anyone who's watching or maybe watching later on. Try to get those questions to us, and then we will be able to. You can just put it in the comments actually, so that we can figure out how to address those issues. So now this week, Lisa Blunt Rochester started her campaign for Senate. Then I am expecting Sarah McBride to start hers in the next couple of days. I'm pretty certain it should be happening. And then there's, one issue that I just find out. News Journal says that for the governor race, Matt Meyer is the first person to open the campaign, but that's not correct. So Bethany Hall actually opened that campaign season in December. Were you there, or was it? I think Alpha came with me. So that was when John Carney was endorsing her. So I think News Journal needs to update that. Maybe the officially is the term that they're using, but Bethany is the first one, and I believe she's a stronger candidate for the governor. So we are going to bring all these individuals hopefully in the next couple of weeks, and then and better understanding Delaware issues, and not just understanding, but what's the right direction would be. Because here's the thing: so whoever is going to run for the office, they don't know these things any better than we do. They also need direction. They also need help from us, and we can't just have our cake and eat it too, right? So we have to make sure that what we are asking is reasonable. Also, we are willing to do what it takes. So no one is going to come with a magical solution to make all the issues disappear. So unless, as an individual, we do our own share, then we can't really expect anything from the government. That's my attitude usually. So I have to actually take care of what I can as an individual, as a company, as a group, and then we expect those things from the government. So that's kind of the key. When many people believe that just because you are going to have this new person, all the issues are going to be magically disappear, and that's not happening. Hasn't happened. Even Obama couldn't do it, right? So that's why we have to really take this seriously and just start from the individual level, see what we can do first, and I think that's the best way to get to the destination. Now we have U.S. economy updates, so I'm going to actually turn this on.
Yeah, we have a few different things here. On our next slide, you'll see this. I know you did want to touch with a couple healthcare related ones at the beginning. Not sure if you want to dive too in depth.
So I think let's do this issue on that many people are seeing these in the news. Oracle, the company that we work with, used to be Cerner. Mm-hmm. Now it's under Oracle, and when we see the news, one is the cutting jobs, the other is the issues with the VA go live, I guess. So they had so many issues, so now it's on hold. I believe there are some concerns and some challenges with this transition with Cerner to Oracle. I've been working with Cerner for 23 years, so since the beginning. It's the first time in the last 2 months I felt like we probably need to look for other options. And that's kind of how the going down starts for companies. For when they bought it, I thought Oracle is the big technology company, so they were going to be able to enhance the system in a really good way. And so far that didn't happen. The other thing that is not happening these days is the way that we have this relationship built in the last 23 years. It was based on availability, support, relationship that we have. So right now, that's not there. And I am hoping someone from Oracle is watching And if they are not, then we'll send this part of the presentation to them as a distributor here in Delaware for Cerner Oracle. We have issues, and I don't think we have. We are actually really. I'm not optimistic the way that things are going, and either the company is too big and they don't really give them, or there's some disconnect. And the other issue that I have, and I think I'm hoping that people from different backgrounds are watching this. One of the biggest issues that I have seen after pandemic is how people manage the digital communication. This could be at the patient level, this could be in business. And one of the first articles during the early part of the pandemic was about how we handle telemedicine and the video meetings, because this replaced in-person interaction that we have with people, with corporations, and all of a sudden. And one of the things that I told my team at United Medical, no matter what we do in any of the meetings that we are in, doesn't matter what the other side is doing, your camera must be on, because otherwise you are going to do that meeting in person. The exchange shouldn't be an audio. Now, if you think about it, Sean, this is very similar for patients. Like we have telemedicine, which is extremely powerful if it's utilized correctly. So from some healthcare providers and some patients, as soon as this became available, they thought this was not a big deal. So then they can be shopping and doing their telemedicine, or they can be in the car while they're driving and doing their telemedicine. And this is definitely not okay. Right. And this is why I'm like, even for the earlier part with the politics, when we look at the issue of what you do as a person, as an individual, then if you do your part, then you can expect from others to bring something more to it, because as we do together individually better, then the synergy would bring a bigger and better things for us. But what I see is just like having my cake and eat it too. So now think about this way: you're a patient, now you have telemedicine available. Before, what you were doing is you had to commute to the office. So 30 minutes, okay, minimum. Okay. Then you have to wait in the waiting room, 15 to 20 minutes, and then wait for the exam and whatever is happening with your physician, and then go to either your office or your home for another 30 minutes. So you would take half a day for that one trip. Now, instead of thinking that I have to make sure that I'm in the right setting for this doctor's appointment, then what patients I see doing is either they're not making themselves available on the video, or some doctors, luckily not our doctors, but I see in other places, they're using the audio as a telemedicine. So now the same thing is happening. Now I'm going to tie that into the Oracle Cerner. So I don't see my Cerner people on the camera anymore. Now, I know who they are, but you don't. You haven't met them in person. And if these things were happening in person before, you would be able to build relationships. So this is actually one of the disease of pandemic these days, is not being able to understand what you're missing. So if you are not available for an in-person, your technical equipment needs to be ready for a proper video call. Period. So now I see this is taking us, how I was complaining about the issue of not being able to build relationships, because now you're not connected to these people. You don't know who these people are anymore. Right. And I constantly see the same thing. Like insurance companies, they do the same. So they never turn their cameras on. Like that meeting used to be in my office. They used to travel to my office, but now they don't even turn their cameras on. Think about how bad this is from the business standpoint, and what it can do to the business. And I think that's what most companies, especially bigger organizations, are going to struggle in the near future, because each element of every company, like you as a business development person, you represent United Medical.
Mhm.
So if you don't do your part, because your contribution as one person, one element is still extremely important for us to keep that client relationship, building that relationship, maintaining that relationship.
Definitely.
So if they don't know who Sean is, they don't know who Kim is, they don't know who Kosibi is, then things are going to be so difficult because we ride on that relationship today, what we build. So these companies, they need to bring their people back into the offices. And, I'm not saying that people shouldn't work from home. That's not what I'm saying. But I'm saying that it needs to, if it's full-time for a person who's supposed to be interacting with people like us, then they need to actually be available either on a video, or they should be coming into the in-person meetings. This is an issue, not only issue for Oracle. I can see this, like Elon Musk was complaining about the same problem, right? Yeah. So it's also creating social issues, because these, as you are not able to now socialize and go and do certain things that you normally would do, you are not able to meet certain things that you as a person need. And then other things are coming other than the job-related issues, depression, anxiety, like loneliness, all those things are coming together. But overall, the production is going down. And I need Cerner Oracle to hear me and take this seriously. We are not just one small company here. We have 800 to 900 end users. And I don't want this to become a big problem, because I had it now, because like this year, first time, we're not going to the Cerner conference, because it's called Oracle conference now. And they think that this is something that we are dying to go. That's not the case. No one wants to travel these days. Now, this Monday, Sunday, I'm going to travel, and I already got the warning from American Airlines saying that the flight may not be happening for the severe rain conditions, like that, right? So no one wants to be away from their home. So, and we're not going this year because how we are being treated. So I need Cerner Oracle to hear, and I want to make sure that this section is specifically out there as a shorter video for them to hear what's happening in Delaware, which is going to have a bigger impact. And I'm going to talk about this publicly even more if things are not being fixed. So now let's move on to the cage fights.
Yeah, so we didn't go too in depth on the Oracle Cerner issue there, but sarcastic. Yeah, there's other things in the news, and as we touched earlier on what's being presented, like I said, how you get your news from, back in the day it was newspaper, radio, TV, now it's on your social media. And it's almost like that's what you're forced to pay attention to. So for those, obviously, if you've seen any type of news, any social media, I know the past week was all about the submarine that went down to the Titanic. And now, well, I guess that story is now concluded, it wrapped up, but they said that it floated, so that story is over. So now the new one is Elon Musk and Mark Zuckerberg getting into a cage fight.
Who's going to win? What are you betting?
It could be.
I'll put $100 on Elon Musk.
Well, I know that Mark is taking jiu-jitsu classes, so
yeah,
depends what kind of fight. I mean, is it
a lizard?
So I don't know. It's just the fact that
he's so nerdy. Like he should be like beaten up by like really nicely. Maybe I'll change his attitude a little bit.
Out, we'll see. Well, if it's an MMA fight, I'll be punching thrown kicks.
So who are you putting your money on?
Just straight up, I would say probably Elon has a side advantage.
Yeah,
I mean, definitely different weight class.
You can just sit on it.
That guy, yeah, they have to get to a similar weight class, I think. So I don't know if Mark's going to put on weight or Elon's going to cut, but we'll see.
We'll see, right? So now Again, what you are saying is important, right? So this is another maybe distraction. So your first reaction was like, is it another distraction? Because this submarine today or last night, it came out that actually we knew about this on Sunday. Mm-hmm. Now, earlier when we were talking about another issue, how much time this 5 stupid rich men took from us? Mm-hmm. Just think about how much time everyone spent. Also, how much money is being spent to find these people? Now, the same week, like in very specific this week, 750 migrants were missing. They were pushed by, I'm not going to name the countries because it's not important, but one of the European countries pushed these people to die in the Mediterranean Sea, right? So 750. So this may be a little visual for people. So 5 versus 750, and many people in the United States don't even know about these 750 people. Mm-hmm. Another 55 people from Morocco to Canary Island, and they died. No one knows. But this 5 stupid rich men, and one of them forced his 19-year-old to go with him. He forced him. What a horrible father, right? So, I mean, why? I mean, would you go to that trip like for $250,000 and then just take this much time from everyone because you died in a really stupid way?
I wouldn't go.
How about 100,000?
Yeah, if I had a coupon, that would be different. But no, I mean, you're saying just the whole gist of the media paying so much attention to it. Obviously, they decided to go on that as opposed to the other side is people, fleeing their country. And obviously 5 or 750, just what the news will show you. But yeah, I mean, but
the U.S. Navy already said that this was already detected on Sunday. Mm-hmm. Problem is, why did we also spend all that time to search for what happened to this if we knew this on Sunday?
Well, I'm sure that other boats go missing too with 5 or more people on them all the time. They were getting caught in a storm or anything. Like, what are those rescue efforts? How much budget is on them? Is it because who was on this submarine, the multimillionaire British guy, or I don't know what made this so desirable to go find this?
But I think who's going to pay the expenses of
you and me?
Good job, a good way to spend the taxes. So
I mean, obviously you want some type of effort. If there's a lost vessel, you want some type of acknowledgement, but to what extent, where is that threshold, like we're saying? So plus I know the vessel didn't pass any of the safety regulations ever. So
must be people do stupid stuff, why would you do that? It's just it's so irresponsible. Every time we make decisions, I always think about not just me personally, but people who rely on me. If you make a wrong decision, then it's going to affect everyone else. Mm. And that is, that's just some horrible issue. And this budget mistake.
That another thing too, talking about the taxes, who's paying for it. So yeah, the oversight of the government overestimated the military equipment they sent to Ukraine by $6 billion. So they have that surplus now. But they said it will be used again for future security and defense support. So you just backtrack to think about our other sessions where people are living paycheck to paycheck, trying to figure out how to afford a medication, get to their doctor's appointment. They can't afford the Uber. That's why they have to they have no option but to miss these appointments. But then you have these types of tax surplus,
well, let's actually elaborate that a little bit, because when you say that, people who are watching, they may not understand where you're coming from. Mm-hmm. But as a reminder, so that people should know, you are part of our daily case conference, right? So as the daily case conference, what we are doing with our nurses, they are presenting the cases, and usually problematic, challenging cases. And we try to figure out a way to help these patients and then understand what they are struggling with. So when you said taking Uber to their doctor's appointment or some other transportation issues, and what they are not able to actually support, or they are not able to
Afford them.
they are not able to afford. That's like, just so that when you say that, I just want to certify that you're not just saying this because you already see this every day with our social workers and how they are helping.
Right.
And every little bit has an impact on how patient is able to follow the physician orders, provider orders, because in some cases, financial issues are the biggest challenge for our Medicare and Medicaid population. So the co-pays, the co-insurances, and the prescription drugs, this all that's up,
in that survey, that wages and employment, the economy factors are, 30% of Delawareans 10 years ago said that was their number one concern, what they're focused on, what they're worried about. So it's a real factor.
All right. So now, when we were preparing for this session, I was giving you some other issues, background on some of the other issues. And one of the, when we are trying to find the main problem of the setup that we have is the way that the United Nations is set up. So, and we now see this on a day-to-day a little bit more, because when there is two extremists, I guess, or maybe two different part of the oppositions, right? So then there's the West and there's the East with Russia and China, and the other side is European Union and US. So one interesting thing that we see is in the United Nations Security Council, the permanent members are those individuals who are actually opposed to each other on any given day, yet they are the one who has the power. So that kind of makes me question of these issues that we are dealing today. If this is all just like the game that we are just being part of, or because we are like, look, we know what's happening in Ukraine these days, what's happening in other part of the world, and our people are communicating. We still buy stuff from these countries. We invest, or they invest. So you were saying the other day how much China owns in the United States. I'll give you another example of that. I think Saudis own almost 7%, if I'm not mistaken, what we have in the United States. So like in the stock market and all the other things that US owns, that 7% is from Saudis. This actually became a big issue in after 9/11. So they actually did take some of that out of US. I remember vaguely, but when you look at the actual setup of United Nations, it's almost set up on the basis of trouble. So because if US, UK, France, Russia, or China, if one of these countries says no, things don't happen.
Right.
Just one.
At the same time, Russia's in a war right now. So,
but then
think about it.
All the decisions that United Nations is able to make, Russia is able to veto, or same thing with China. So, and it's an interesting mix there when you look at permanent members. And why do you need a permanent member when it's called United Nations, right? So if you're not equally represented, or proportionately represented, maybe I would say, then I think some of these troubles that we have, that's where they are coming from. Now we have our Bariatric Friday starting in the next 3 minutes. Hopefully we won't have these technical issues that we had earlier. So Dr. Erkan is going to join us. So now we are going to try to confirm some of our guest speakers. There are at least 4 or 5 of them. We need to confirm them, and then we'll be back next week, same time. Thank you so much for